This study and this video were made possible by a grant from Morris Animal Foundation in conjunction with the Barclay Fund at the Cummings School of Veterinary Medicine and IDEXX Laboratories. We thank Philips Healthcare for the use of the ultrasound machine for this video. The goal of this video is to teach veterinarians in general practice how to perform a 2-minute screening echocardiogram on cats. Cats often present with heart disease and lack a loud murmur or gallop. So the first sign of heart disease is often a presentation for congestive heart failure or arterial thromboembolism. This study aims to determine whether veterinarians in practice can learn to perform a 2-minute screening echocardiogram and whether this exam is a better tool to identify asymptomatic feline heart disease than NT-proBNP testing or routine auscultation and physical exam findings. The ultimate goal is to find the best method to screen cats in general veterinary practice for occult heart disease so they can be diagnosed and treated before they present with overt clinical signs. This study is going to examine echocardiography versus physical exam versus ECG versus an NT-proBNP test in the diagnosis of asymptomatic feline heart disease. The 2-minute screening echocardiogram differs from the full echocardiogram that you're more familiar with. The 2-minute screening echocardiogram is a brief exam to be done by a primary care veterinarian during the course of a routine wellness visit in middle-aged or older cats or in cats suspected to have heart disease on auscultation, while the full echocardiogram is a complete echocardiographic study performed by a cardiologist, often requiring 15 to 30 minutes. The 2-minute screening echocardiogram is a qualitative assessment of the left heart only, while the full echocardiogram includes quantitative and qualitative assessment of all cardiac chambers, valves, and the great vessels. Finally, the goal of the 2-minute screening echocardiogram is to determine whether a cat is a candidate for a more complete echocardiogram, while the full echocardiogram is currently the definitive test for diagnosis of feline heart disease. The first step is to get some familiarity with the ultrasound machine. We've already got the ultrasound machine turned on, but in your ultrasound unit you have to find the on-off button. The next job is to select the probe that you're going to use for the 2-minute screening echocardiogram in cats, and this machine comes with 3 different probes. It comes with an S12-4, an S8-3, and an S5-1 probe. In general, for cats you're going to want to use the higher frequency probe like the S12-4 probe, as it will image a cat heart better, and we don't need the penetration of the larger probes, except maybe for a large obese cat. In addition, the 12-4 probe has a smaller probe footprint, so it will be easier to get between the ribs with the smaller probe. There are a few other important buttons to look at. First, we might want to look at the patient ID section, and most machines will have a way to enter a medical record number, a last name, and the cat's name. Whether or not you enter this information on each cat may be a subject of debate. You probably would not make a phonocardiographic recording for auscultation findings in all cats or take a picture to document every cutaneous bump, but you would record these findings in the medical record. For the 2-minute screening echo, if you do find something abnormal and wish to add identifying information after the fact, then most machines will allow you to add this information to saved images. Saved images are ideal if you feel the cat needs referral for a full echocardiogram. However, the goal of the 2-minute screening echocardiogram is that it is essentially an extension of your physical exam, and saving images with identifying information on all cats may be impractical, and documentation of your subjective findings in the medical record might suffice. The next thing to select is the transducer, and you can see that we've already selected the S12-4 transducer, but we could use this button to select a different transducer. Each transducer typically has several presets. We may use the presets buttons to identify whether we want to do an adult or a pediatric echo. You may have a specific feline echo preset on your machine, and if you do, then you'd like to use that preset. This particular preset has the ECG running, and again, for the 2-minute screening echocardiogram, we're not going to need the ECG, so we might press the physio button and turn off the ECG. The next button we might get familiar with is the imaging depth on the machine. And as we change the depth on the machine, we can see the depth change here or here. We're currently set for 10 centimeters, which is much deeper exam than we might need in cats. So we might adjust the imaging depth down to 4 to 6 centimeters. 4 to 6 centimeters is usually adequate depth to be able to fit the cat's heart fully onto the screen. The next thing we might want to adjust is the focal spot for imaging, which on this machine is adjusted with the same knob used to change the imaging depth. The optimal focal spot for the image is identified here by this dot on the screen. This focal spot is the level where the best echocardiographic image will be obtained, so you'd like to adjust the focal zone to the area of interest, which for our exam will be the level of the left atrium and the left ventricle. We might also want to adjust the gain, and there's an overall gain that can be adjusted upwards or downwards based on the image obtained. Once you start to obtain an echo image, you'll adjust the overall gain to create the image that's not overly bright or overly dark. The second gain adjustment is called the TGC, which can be adjusted to make certain sections of the echocardiographic image darker or lighter. For example, we can change the far field gain to make the distal imaging region a little lighter or a little bit darker. Once you've started to image the cat, TGC buttons are adjusted to try to maintain a nice picture throughout the whole depth of the echo image. The next thing you may want to do on selected cases, especially if you're hooked up to a printer, is to record a finding from the exam. By pressing the freeze button, you can create a still image that you can either store or print by depressing the print button. If you want to retain an image to the machine's memory for long-term storage or for subsequent printing, then you can press the acquire button in order to save the image. There are only 2 echo views to be obtained with the 2-minute screening echocardiogram. The first echo view is the short axis image of the aorta and left atrium, and the second view is the short axis image of the left ventricle. Both of these views are obtained by imaging from the right side of the thorax close to the sternum, often referred to as right parasternal images. The first image depicted here is the right parasternal short axis view of the aorta and left atrium. The ultrasound probe is placed on the right side of the chest, close to the sternum, and the ultrasound beam is directed towards the heart base to go through the aorta in the center and the left atrium in the distal field. The right heart is in the near field, but we're not going to concentrate on the right heart for the 2-minute screening echo in the cat. As the ultrasound probe is directed ventrally, the image now cuts through the left ventricle to obtain the second view, the right parasternal short axis view of the left ventricle. In this view, we can note the interventricular septum, the left ventricular cavity, and the left ventricular free wall. On the first view, the relationship between the circular aorta in the center of the screen and the teardrop-shaped left atrium in the distal field will be evaluated. The right heart is wrapping around the aorta in the near field, but we're not going to concentrate on the right heart for this exam. To obtain an accurate short axis view, one should concentrate on the aorta and make sure the aorta is very circular. If the aorta looks oblique or like an oval, or if you can also see the mitral valve in the image, then the probe should be rotated or repositioned until the aorta is very circular. Once you have obtained a good view of the aorta and left atrium, one should visually assess the relationship between the two structures. In general, if one were to take the circular area of the aorta and transpose it visually over the left atrium in a normal cat, you should not be able to fit more than 2.5 to 3 aortic dimensions inside of a normal left atrium. If more than 3 aortic dimensions fit inside the left atrium, then the left atrium is likely enlarged. Cats with an enlarged left atrium are candidates for a full echocardiographic exam by a cardiovascular imaging specialist. On the right side of the screen, you see an echocardiographic image from a cat with moderate left atrial enlargement. Note that the aorta is quite round. If you visually assess the area of the aorta and estimate the number of aortas that will fit inside the left atrium, one could easily fit 8 to 12 aortic dimensions inside of this enlarged left atrium. The second view to be obtained on the 2-minute screening echocardiogram is the right parasternal short axis view of the left ventricle. On this view, one should be able to image the interventricular septum, the left ventricular cavity, the left ventricular free wall, and the papillary muscles. One should strive to have the cavity of the left ventricle look a bit like a mushroom, with the cap of the mushroom bordered by the interventricular septum, and the symmetric papillary muscles on either side of the stem of the mushroom. If the cavity of the left ventricle looks asymmetric, if the cavity looks oblique, if the papillary muscles are asymmetric in size, or if you can see the mitral valve in the image, then the probe should be rotated or repositioned until you can see a clear circular left ventricle, if you ignore the papillary muscles, or a mushroom-shaped left ventricle with symmetric papillary muscles. Once a good image of the left ventricle is obtained, one should assess both the wall thickness and the vigor of contraction of the heart. When comparing to the normal echocardiographic image on the right of the screen, the left ventricle on the left side of the screen has good contractile function, but the walls of the left ventricle are thickened. Picture the size of the left ventricular cavity in diastole when it's full of blood and at its largest dimension, and compare this cavity size to the thickness of the left ventricular wall or septum. If the size of the left ventricular cavity, when it's full, is a unitless dimension of 1, then the thickness of the interventricular septum and the left ventricular free wall should be approximately 25 to 35% of this cavity dimension. If the thickness of either the septum or the left ventricular free wall looks to be more than 40% of the size of the left ventricular cavity in diastole, then there may be hypertrophy and the cat is a candidate for referral for a more complete echocardiographic study. Other findings seen in cats with hypertrophic cardiomyopathy that might prompt a decision for referral include very prominent papillary muscles or a subjectively small left ventricular cavity, especially at the end of systole. The next item to assess from the right parasternal short axis view of the left ventricle is the vigor of contraction of the left ventricle. If you visually assess the cavity of the left ventricle from the point that it is full of blood until it's finished ejecting blood at the end of systole, you can guesstimate the amount of blood ejected with each heartbeat. When comparing the size of the left ventricle when it's full of blood to the left ventricular cavity size once cardiac contraction is ended, the left ventricle should normally empty approximately 50 to 70% of the blood in the cavity with each heartbeat. In cats with reduced vigor of contraction of the heart or low contractility, the amount of blood ejected on each heartbeat is markedly reduced, with less than 50% of the blood volume ejected on each heartbeat. When compared to the normal heart on the right-hand side of the screen, the heart on the upper left-hand side of the screen has markedly reduced contractile function of the left ventricle. If a cat's assessed to likely have reduced vigor of contraction of the heart, then it is a candidate for referral. As you prepare to obtain echocardiographic images, a quick checklist may help to ensure the process goes smoothly. First, make certain the machine is powered on with a high-frequency probe and a depth of 4 to 6 centimeters. In cats with thick fur, you may need to clip a small amount of hair over the right cardiac notch in order to obtain high-quality images. In most cats, application of alcohol or ultrasound gel to wet down the fur is enough to permit a good echo exam. The 2-minute screening echocardiogram is usually done with the cat in a comfortable position, often standing or cradled in someone's arms. Apply a generous amount of ultrasound gel to the ultrasound probe and pull the cat's right forelimb forward just a little bit to facilitate imaging. Placing the probe over the cardiac window with the marker of the ultrasound probe pointing forward or cranially. Aim the probe towards the left side of the chest, often with mild angulation caudodorsally towards the last few ribs. Adjust the probe a bit more dorsally to image the aorta and left atrium, and just a bit ventrally to obtain the left ventricular view. Adjust the overall gain, the TGC, and the focal point to obtain the best possible images. You can apply more gel as needed to improve the image quality. This is Vladimir, a 4.5-year-old Peterball, who's here to help demonstrate the anatomy of probe placement for doing a 2-minute screening echocardiogram. We're going to be imaging with the cat in a standing position, and we're going to want to image the right side of the chest ventrally at the cardiac window. We can't image through the lungs, so the cardiac window is going to be down in this particular location near the sternum. It's often easier to get a decent image if we can pull the right leg forward just a little bit. In most cats, this is the approximate location where we'll be able to put the probe on the chest and be able to image the heart. In a cat without hair, we might not need alcohol in order to get a good ultrasound picture. We'll have the probe marker aimed cranially, at least that's the way it's set up on this machine. After putting the probe on the chest, we can start to look at the echocardiographic image of the beating heart. In this location, we have an echo image of the heart beating. By rotating the ultrasound probe, we can adjust the angle in order to best image the heart. In this particular case, we're aiming just a bit caudally. We can change the depth by making the left ventricle a little bit bigger on the screen, and we can see that Vladimir's heart is contracting well with a left ventricular cavity size that looks normal, and the left ventricular walls are normal to perhaps slightly thickened. Now we move up from the left ventricular image to the aorta and left atrium view. You can appreciate that Vladimir has a fairly normal-sized left atrium. You can see that when he breathes, his lung comes back into the picture and we lose the image a bit, so it's not the prettiest of echo exams, but we get some idea that the left atrium is fairly normal size relative to the aorta. We come back down to the left ventricle. Again, he's got good left ventricular contraction. He might have a little bit of thickening of the heart, and whether or not he gets referred for a full echocardiographic exam and measurement of wall thickness may be subject to judgment. But at least at this point in time, his left atrium is not big and he doesn't look to be close to congestive heart failure. For our next case, Gordon is a 3-year-old neutered male cat who comes in for a wellness exam and has no auscultatory or physical exam findings suggestive of heart disease. As we take a look at his echocardiographic exam, we can first see the left ventricle in the short axis view. The left ventricle looks to be contracting well and the wall thickness looks to be normal. This looks to be a ventricle that ejects at least 60% of the blood volume on each heartbeat, which is normal. When the heart is full of blood in diastole and the wall thickness is subjectively evaluated compared to the cavity size, the walls are perhaps 30 to 35% of the size of the left ventricular cavity. As we move up to the aorta and left atrium, the left atrial size looks to be normal. When visually assessing the circular size of the aorta and estimating how many aortas might fit in the left atrium, we come to the conclusion that no more than 3 aortas would fit inside this normal left atrium. Thus, this cat's heart looks fairly normal and no further testing would be indicated. Our next case is Liam, a 5-year-old neutered male cat with a soft murmur on cardiac auscultation. In looking at the short axis view of the left ventricle, Liam has good vigor of contraction, but he has hypertrophy of the left ventricle. Especially notable is the prominent papillary muscles towards the apex of the heart. As we move the probe up towards the aorta and left atrium, we can see that he has a moderately to markedly enlarged left atrium. To better fit the left atrium in the image, we'll change the imaging depth, and now you can appreciate the full size of the left atrium. At least 10 to 14 aortic dimensions would fit inside of this left atrium. In this cat with hypertrophy of the left ventricle and marked enlargement of the left atrium, referral for an echocardiogram with quantitative measures is indicated. This is a short axis view of the left ventricle from a cat. Please review the image and identify notable findings from this echocardiogram. This echocardiogram shows a dilated left ventricular cavity with markedly reduced left ventricular contractile function. The right ventricle is also dilated. This echocardiogram is recorded from a cat with dilated cardiomyopathy. Referral for a complete echocardiogram would be indicated. This is a short axis view of the left ventricle from a cat. Please review the image and identify notable findings from the echocardiogram. This echocardiogram shows a hypertrophied left ventricle with thick left ventricular walls, a normal to small left ventricular cavity, and normal to somewhat reduced left ventricular contractile function. There's also a small volume of effusion around the heart. This echocardiogram is recorded from a cat with hypertrophic cardiomyopathy. Referral for a complete echocardiogram would be appropriate. This is a short axis view of the left ventricle from a cat. Please review the image and identify notable findings from the echocardiogram. This echocardiogram shows a normally contracting left ventricle with normal left ventricular wall thickness, normal cavity size, and normal papillary muscles. This echocardiogram is recorded from a normal cat. Unless this cat had a loud murmur and/or an elevated NT-proBNP concentration, a more complete echocardiogram is probably not necessary. This is a short axis view of the left ventricle from a cat. Please review the image and identify notable findings from the echocardiogram. This attempted echocardiographic study failed to find the left ventricle. There is pleural effusion and a cavitated mass inside the thoracic cavity, but nothing can be said about the heart from these images. Non-diagnostic studies should be recorded as such, and the decision on referral for more complete cardiac workup should be made from the remaining clinical findings, such as the presence of an arrhythmia, gallop, or murmur, the NT-proBNP result, or cardiac size on radiographs. This is a short axis view of the aorta and left atrium from a cat. Please review the image and identify notable findings from the echocardiogram. This echocardiogram shows a normal relationship between the size of the aorta and the size of the left atrium. Normal left atrial size is present. This echocardiogram is recorded from a normal cat. Unless this cat had a loud murmur or an elevated NT-proBNP concentration, a more complete echocardiogram is probably not necessary. This is a short axis view of the aorta and left atrium from a cat. Please review the image and identify notable findings from the echocardiogram. This echocardiogram shows a markedly enlarged left atrium. One could easily fit more than 10 to 12 aortic dimensions inside of the enlarged left atrium. This echocardiogram was obtained from a cat with advanced cardiomyopathy, and the cat was on the verge of congestive heart failure. A small volume of pericardial effusion is noted in the near field. Referral for a full echocardiogram would be appropriate. It's important that you perform a 2-minute screening echocardiogram on 25 cats first. We need to make sure that you can obtain the requisite views for the study on the majority of cats. If you have trouble getting views after imaging multiple cats, then please contact one of us so we can help you. After completing your 25 practice cases, please return to the video and review it one more time to see if you can pick up 1 or 2 pointers that you might have missed. After that step, we're ready to start the study.